Hello, my name is Charmaine Stevenson. I am a registered nurse. I am currently enrolled at ACPI University in the BSN program, and I will be presenting my BSN Senior Practicum on hand washing. Hand hygiene is the act of washing your hands with soap and water for 20 seconds and or the use of an alcohol-based hand rub. Hand hygiene seems relatively simple, right? However, you will be stunned to know how many people are not washing their hands. The goal of this project was to design, implement, and evaluate proper hand hygiene in a clinical setting by implementing a monitoring program, also while providing positive reinforcement to encourage compliance with hand hygiene. The objectives for this project are as follows: analyze current literature on effective hand hygiene in a clinical setting, which will be discussed later in this presentation, implement the pre and post quiz, as well as an in-service on hand hygiene in a clinical setting, evaluate the outcome of the in-service training on hand hygiene in a clinical setting. Throughout my presentation, my objective was to educate staff on the importance of hand washing. I analyzed 10 different pieces of literature on hand washing. I did not think I would be able to find something different, but the amount of information that I found was astonishing. I wanted to be able to provide facts. Studies have shown that hand washing continues to be a concern within the healthcare setting. In some countries, hand washing is around 40% compliance. Hand washing is around 50% compliance nationwide. There is a need for continued education and monitoring programs. Studies have also shown before COVID, hand compliance was around 54.5%, and during COVID, hand hygiene increased to 92.8%. That is a significant jump in numbers by implementing a hand hygiene monitoring system and constant education on ways to prevent the spread of germs. After reviewing the appropriate literature, I presented my teaching by way of in-service. Before I started any teaching, I administered a 5-question pre-quiz. I used educational materials about hand washing versus hand sanitizer and a poster board as my visual aid. I really stress the importance of hand washing from the time you start your shift until the end of your shift. We are touching so many different objects throughout the day, from our cell phones, computers, omnicells, doors, and the list goes on. We are in contact with thousands of germs daily, and I'm being a little bit conservative. Did you know that some hospital systems are spending an estimated $8.3 to $11.5 billion on hospital-acquired infections? Also, simple hand washing can decrease respiratory illnesses by up to 21%, as well as prevent 50% of deaths due to diarrheal diseases. If everyone routinely washed their hands, 1 million deaths could be prevented yearly. During my in-service, my peers were asked to perform a teach-back demonstration of effective hand hygiene and to take the post-quiz to evaluate the effectiveness of my teaching. And I must say, we really had a good time doing teach-back demonstration of hand washing. Overall, my peers provided positive feedback and saw the need for ongoing education surrounding hand washing. Nurses have the education, but compliance is simply not there. There are moments when we have student nurses on the unit, and we have to set and be the example for future nurses. There are studies that show noncompliance in hand hygiene during patient care in around 75% of nursing students. This is why ongoing education should be prioritized in the hand washing effort. The topic of hand washing may seem simple and silly, but the need for education is there. You can never be too busy to wash your hands. Washing your hands should be a hard stop before patient care. I knew that there was a need to revisit hand washing because I see nurses every day not washing their hands or sanitizing their hands. Physicians too. It's become such a simple task that it can sometimes be forgotten or overlooked. We have to be mindful to remember the small things because it will carry us a long way. And remember, clean hands are safe hands. I hope you enjoyed my presentation, and here is a list of references that I used for this presentation.